Hi, I'm Tom Delonzo Baker, the founder of Total Motion Release. Patients and therapists and people just learning this for the first time often ask, why aren't you treating my injured area? Why aren't you treating to the good side? It's a good question. The thing that I try to point out to patients is that let's set up an experiment where you get to choose and you get to look at the results of both of them and determine for yourself which one worked better. So what I mean by that is there's nothing wrong with going to the injured area, doing some treatment and some exercise to it, see what happens. Then, actually, you can go to both sides at the same time, treat or exercise to it, see what the result is to the injured. And then you can go to the good side or the good areas of the body, test or exercise towards them, and see what happens to the bad area or injured site of the body. Easy? So let me just take an example of what I mean by that. I don't ever want you to feel that I want you to be able to assess for yourself whether what you're being presented makes sense. Because you've been, and we've been programmed as therapists and patients that you must treat the area of injury. It's the one that works. But you're going to learn, hopefully, that it's actually the least effective and least efficient. It works a little bit, and then you got to do a lot more over time. We'd much rather have a result that's quickly working now, and then it won't take you as long to heal. So let me just give you an example of that. I'm just going to test this motion here. So I go pretty nicely here. My body twists all the way down. And here, it just kind of stops. It gets tight right here. It gives some pain here. And it gets tight in my ribs in the back. Now, let's just say I wasn't improving. I'd been here for a bit. And I go, why aren't you treating to that side? Or I'm a brand new patient, not figuring out, why aren't you treating to that side? Now, as a therapist, I'll step back and I say, okay, we have three things we could do if we're motion testing or treating by motion. We could treat to this side, we could treat both sides, or we could treat this. And why don't we set it up so you determine how well it works. Here's how easy it works. Just go ahead and first let's start with the bad side. Maybe do reps. Okay? Maybe go into end range and hold it for 20 seconds. Maybe get a weight and do it. Whatever you'd like to do, or you're used to doing, go ahead and do. Now, as I say, is now rest after you get done. Do 2 sets, 3 sets. Rest until you feel like you're kind of back to the baseline, and then retest to see if it's any better. If it's better, it means that worked immediately, and just kind of feel how good it worked. Many of you might say, but wait, that's the bad side. It's not going to feel better because I worked it. All right, well, take that and hold that in the back of your thought for a second. Because if I come over to the other side and it gets better, that's awesome. All right? Or it gets better, bigger better. It gets more better. All right, so now we did that side. Now, setting up and being good scientists, now let's do it this way. Do both sides. You see people do that a lot. They're stretching or whatnot. You can do reps or you can do holds. Just try to go it. All right, and do your 2 or 3 sets, 20 seconds each, or 12 reps each, and see what happens. Then rest for a second, and retest this and see if it's better. And then the last thing, now go to the good side. Go. You could do 20-second holds, keeps on pushing to end ranges, or you could do reps. You'll begin to find out that perhaps reps don't work as well as pushing into end range. Or maybe weights will work even better or something. But for right now, do that. And then retest this. And now you set up your own experiment and you go, wow, that's why they're treating to this side. It works faster. Now, we are happy as therapists to set this up. It's a beautiful thing to set up. So don't ever walk away and go, God, I just don't understand why they're not treating my good side. Go ahead and ask. They'll go ahead and do it the old traditional way and just find out what the results are. Because we're not saying the good side's the only one that works. What we found out over hundreds and thousands of trials and testing is that going to the area that does not want to go, going into the motion that it doesn't want to go to, does not produce the fastest results, and it doesn't seem to last as long. Cool? I hope that helps. Thanks for joining me.